I'm also really excited to talk about ARFID, which stands for Avoidant Restrictive Food Intake Disorder, and really affects a lot of people, kids, teens, and adults, and is not talked about as much. So I'm glad to lend a voice to that alongside, how it can show up with people who struggle with selective mutism as well.
That's awesome. And one of the things you just said is that it's not talked about as much as it should be. What do you think the reasons are for that?
A big part of that is it was always considered a developmental diagnosis and often looked at in infants and early childhood. And within the last 10 years, it started to be recognized as a diagnosis that persists beyond early infancy and childhood. So those kids that struggle with it early on typically grow up and continue to struggle with it. And just to kind of rewind a little bit, avoidant restrictive food intake disorder is a difficulty with eating that is not based on a desire to control weight or body image, but it's usually based on properties of the food or feared consequences of eating food, or maybe a lack of interest in food. And sometimes we think of those folks as extremely picky eaters. And you see it a lot in kids, and that's developmentally normal to an extent in kids. But when it starts to impact ability to function across really important domains like socially or getting adequate nutrition, it starts to really get out of control. And that's when you start to get a diagnosis like ARFID. And so about 10 years ago, the manual that we use to diagnose psychological disorders, which is called the Diagnostic and Statistical Manual, got updated. And they decided that ARFID actually is its own standalone diagnosis. And they moved it into the eating disorder section, whereas before it was considered more of a developmental diagnosis just for little kids. And so with that move to the eating disorder section, it allowed people to start actually getting assessed and diagnosed. And now there's a lot more research and attention and awareness and discussion around it, but it's still in its infancy.
Yeah, no, that's awesome. That's awesome information. I was also thinking that the lack of awareness is also probably a challenge because people don't know necessarily what ARFID is. And we have the same thing with selective mutism. People don't always understand it. They may have heard the term, but they misunderstand it. So one of the goals for today, and I so appreciate, this information you're sharing, is to really clear it up. Like, what is ARFID, how it presents, how we can, treat it in many ways, how to differentiate it from other eating disorders.
Yeah, so ARFID right now is a little bit of a catch-all for any kind of picky eating concern that is really impairing functioning to a significant degree or causing health difficulties. But there are three subcategories that sometimes people experience more than one, but often they're pretty distinct. One is a lack of interest in eating or food, and that's where people often don't find food to be very interesting. They don't necessarily find it to taste good. Sometimes they struggle with feeling full, and that can be overwhelming, and so they'll stop eating early on, and they might struggle to get adequate calories or nutrition or keep their weight up. The second category is people who struggle with sensory characteristics of food. And that's where they have issues with textures or smells or colors, or they have certain rules about food. Sometimes they'll only eat certain brands. Sometimes they'll have rules about whether food can touch. And it can start to look a little bit almost like obsessive compulsive disorder. And so sometimes it's more on the sensory side of things, but sometimes it evolves into rules that don't necessarily make sense to people who don't struggle with ARFID. And the treatment can look a little bit different for that category than it would for the first category. And then the third category is people who are afraid of consequences of eating. So they avoid food because they're afraid they might gag or choke or vomit. And sometimes that's just due to a fear in general, but sometimes that's due to previous past experiences that were pretty negative. And that might be because they've had medical issues that led them to vomit or choke on food. Sometimes they'll have gastrointestinal issues or allergies, especially in infancy, if there were allergies that cause those kinds of reactions that then led to fear or food avoidance. And kids can't say what's going on. They can't say that they're having an allergic reaction. They just know they're not going to eat that. And that can even be rejecting breast milk or difficulty transitioning from breastfeeding to solid foods. And that's usually when it starts to show up to parents of, okay, we need to really do something about this early on. But so those are three very different categories of what it can look like. And I think as we start to study it and look at it and learn about it, those might even evolve even further into the future about how we're even looking at those. Are they all the same thing? Should they all be treated the same way? And hopefully part of this discussion will be about whether, what makes sense for each of those things, tailoring to the individual need.
Well, it's interesting because, as I said, having picky eating challenges, sensitive eating challenges, however people want to see it, and now really talking about ARFID, this is something we see in this population. I talk about the quad a lot: eating, sleeping, behaviors, and toileting. And they often come together, but sometimes you have one or two of them. When we see this, especially at the more they have of that quad, the more there's a sensory relationship. I would say by far, the far majority of individuals with selective mutism that have eating issues, ARFID here we're talking about, are the sensory sensitive kids, where it's more the food textures, the tastes, just the sensory aspect. So what I'd like to do, and it doesn't mean that they don't have some of these other two avenues that you talked about, with the lack of interest in eating and worrying about the negative consequences of choking and gagging. I'm not saying they don't exist. And like you said, maybe there's an overlap and one evolves to the next.